Okay, this is fun, folks. Chances are it's a skin condition you've never heard of. And those who have it, well, they may be having it for years before it's diagnosed. So Dr. Gregory Delost is here from Optima Dermatology, and this is something, I looked at this thing and I was going like, who can learn how to say that? You have to be a doctor. What is it? Hidradenitis Suppurativa?
Yeah, so us dermatologists, we use big fancy words to justify our existence. So Hidradenitis Suppurativa, but we just call it HS to make it easy.
HS. So this is one of those things, somebody might have this and it comes and goes, and they don't even know it's something that they can fix.
So HS could run in families. It's more common in women, African-American women, 30s to 40s. And the sad thing about it is a lot of times patients are just told that, you know, I have boils, I have acne, and they don't do anything about it. They don't think that there's anything they could do about it, and they go years and years with it. And they said that the average patient with HS goes to the emergency room 10 times before they even get a diagnosis of what's going on.
So the emergency room people aren't familiar with it, so they're not going to be able to help you with it.
There's a lot of nuance with it, for sure.
Yeah, so you described this as like a boil or a blister or something like that. And I was reading a little bit, preparing for this, and it seems like it happens in places where skin rubs together.
Right, skin folds, so like under the arms and the groin, places like that where you get skin and skin contact, where you could get these really deep.
There's some beautiful pictures you put up for us there.
Yeah, sorry to show these ugly ones here, but typically with stage 1, you could get a few lumps or bumps on their skin, and then you could start getting more and more recurrent abscesses as you get into stage 2, and then you get more scarring, and then by stage 3 you have all this chronic scarring. So it's a vicious cycle of scarring and abscesses and sinus tracts. And you could see by the time you get to stage 3 how that could be debilitating for a patient, where it could hinder your ability to use your arms to work. It could, you know, if you had this in your groin, it'd be difficult to even sit down. I see a lot of patients that unfortunately have to go on disability because of this.
Okay, so we see the progression of this here. So say somebody's gone through this, it's not quite as bad as that, and it goes away. It goes away, you think you're cured, but it can come back.
Right, I find with this, chronic maintenance is really important. So I always say doctors, we're really good at what to do when things are bad, but sometimes I think doctors, we're not good at what to do when things are good. So it's helping patients like maintain this even when they're in a good state there.
Yeah, I mean, you might mistake that like for an ingrown hair or something like that that just gets bad.
Absolutely, ingrown hair, acne, all kinds of things like that it gets mistaken for.
Yeah, so what's the treatment for something like this?
So you definitely have to take a holistic approach because lifestyle matters for sure. Weight loss could be helpful for this. There's a big link with smoking actually, so if we could get these patients to stop smoking, it could be very helpful. There's different washes we do that are topical. We use different antibiotics as well too. With the infections that could happen, or we could use them as anti-inflammatories. And now we're getting a few different injectable medicines actually that are getting FDA approved now. So I think in the next like 5 to 10 years we're going to have more and more options. I think we're going to almost have like a renaissance of treatments for these patients, which is really important because up until now we didn't have that many good options other than antibiotics, surgical options, things like that. So it's exciting that we're going to have more and more options.
So somebody has this, if it starts to show itself and they're not familiar with what's going on, they might put a dressing on it, which might make it worse, huh?
Certain dressings can make it worse. Sometimes even like different surgical techniques could make it worse as well too. So it's really important that patients are properly diagnosed and treated.
Okay, so you've got a bunch of clinics out there. Somebody thinks they might have a problem like this. What do they do? They get on the phone and what do they do?
Most important thing is to try to get in as soon as possible because if there are abscesses or boils, these are some infections. Yeah, infections that need to be dealt with. And if they're not dealt with, then they're going to be the patient that has to go to the emergency room.
What I notice about Optima too, it is pretty easy to get an appointment. I mean, you know, to get appointments with the medical world is not the easiest thing in the world, but it seems to be like you guys really can take care of people.
Absolutely. You know, when we're in Cleveland, what I call the hospital capital of the world, we have so many good institutions, and the way that we have to be able to differentiate ourselves is access for patients. And for me, access in dermatology is a really unmet need, and that's where we're trying to help our patients out.
If somebody's experienced something like we've seen the pictures and your description, should they make an appointment now and come see you before they have another flare-up, or do you wait till something starts to happen so you can diagnose it? What's the best way to deal with it?
I'd say either way. So if they're having a flare, I'd love to see them that day. My patients know that they can see me right away for that kind of stuff. But even if they're doing well, we could get them on a better maintenance routine to decrease flares, because whenever we get a flare, we get more of the sinus tracts forming, more scarring, and then the cycle continues there.
And we're talking about skin maintenance. What if somebody, they think they're in great shape or don't have that many problems, what should their maintenance be? How often should they come see you guys?
Just in general, we recommend an annual skin check. That could differ based on risk factors. So if
Yeah.
people have histories of skin cancer, we'd love to see them more often.
How about you get older? It should be more frequent?
Definitely, if you're getting older, if you have a history of more chronic sunburns, chronic sun exposure, lighter skin to begin with, lighter eyes,
Right.
things like that. Yeah.
And you're a nice guy. Who would want to come visit you once a year, right?
We'd love to have anyone.
Thank you very much for joining us today.
Nice to see you again.
Yeah, good to
Thank
see you too.